Hi, I'm Dr. Dixit. I'm a dermatologist practicing aesthetic medicine in Koramangala, Bangalore from the last 18 years. And today we are going to talk about anti-aging therapies. You know that there are 4 types of aging? Which one is your face aging like? You could be aging like this, where you're losing only the fat and there is no sagging. Or you could be like this, where you're losing the fat and there is a lot of sagging. It could be like this, where you have both sagging and there is going to be a lot of increased fat deposition. Or it could be like this, where there is sagging and there is a lot of fat deposition. Mostly Indians age like this. So depending on the type of aging that you have, we need to choose the treatments accordingly. So we saw the 4 types of aging, and when you're aging like this, you're aging with the volume loss with no or minimal sagging. In most of the North Indian patients as well as skinny patients, we see this kind of aging. So the treatment for this obviously is the replacement of the volume. This volume cannot be replaced with a cream, it cannot be done with a retinol. You have to use a filler like a hyaluronic gel to be injected here to get the volume repair here. When you're aging like this, you're aging not only with volume loss, but there is a little bit of sagging as well. So here we need a combination of 2 things. 1, to replace the volume which is lost, which is with a filler or a fat graft, and 2, to treat the sagging. And here you can use an intragen, because you can see the patient here is relatively leaner. They don't need a lot of tightening, so they will do well with an intragen or an RF based treatment or a microneedle RF based treatment to tighten up the skin. They can also use a combination of filler with threads, which gives a good support because there is not much bulk involved in this patient's face. If you're aging like this, it means that there is a little bit of hypertrophy of the face. And this is very, very common in our South Indian patients or Northeastern patients, where the face becomes bulkier as we age. And in this set of patients, obviously we can't use an additional volume to make them appear more anti-aged or to make them look more slimmer. We will need to do a combination of thread lifts and HIFU. Threads give a mechanical support, help to define the jawline, help to reposition the fat into the upper layers of the face, and HIFU gives a significant amount of slimming as well as tightening to the lower face, as well as fat reduction in the lower face and jawline, which is going to give you the dramatic improvement in this type of aging. But if you're aging like this, which is a combination of hypertrophy, that means increased fat deposition as well as sagging, then you know that these people will need a lot of help with the HIFU, first to improve the fat and to tighten the skin, then a combination of dynamic threads or good cog thread lifts to give a significant support to improve the jawline and the lower face. So if you are having more of hypertrophy as well as sagging, which is most commonly seen in our South Indian subset of patients, you are going to need a lot of threads. So speak to your doctor about what is the best procedure which is for you, depending on your skin type of aging. How do I know what type I am going to age at? So I can do some preventive treatment to prevent these things from happening. The first thing you have to look at your parents' faces. You will resemble one of them, and you would be aging. You will understand that your face is aging like one of them. I resemble my mum, and you can see that she has got a lot of hypertrophy as she is aged, and she's got a lot of marionette line which is forming. She's also got a lot of sagging. So what do? I have to start preventing this area from aging, the lower face which is going to age not so well. So I start by injecting botulinum toxin into the neck to prevent the lines of the neck of the lower face pulling my face down and blunting my jawline. The second treatment that I would undergo is to have HIFU. HIFU tightens the mask layer, gives me a more sharper jawline, and it keeps the anti-aging process continuous. So the collagen stimulation is continuously happening. Third, and when the problem arises, I would definitely consider getting threads done. This is how a dermatologist is able to suggest different treatments for you. So the same treatment that you have will not be recommended to your friend, because all of us are unique. We age in different ways. So let the doctor be the guide, let the dermatologist be the expert to guide you what is the best treatment, best anti-aging for your skin.